Hi everyone. Today we are going to learn about NLEP, that is National Leprosy Eradication Program. I am Dr. Bula Dallas, HOD of Community Health Nursing Department, Triple M College of Nursing. The National Leprosy Eradication Program is a centrally sponsored health initiative in India aimed at eliminating leprosy as a public health problem. India has made significant progress in reducing the burden of leprosy, and National Leprosy Eradication Program plays a crucial role in early detection, treatment, and rehabilitation of affected individuals. Let's see the milestone of this program. 1955, this program was launched as the National Leprosy Control Program. Shortly, we can call it as NLCP. It was focused initially on survey, education, and treatment using dapsone monotherapy. In 1982, introduction of multi-drug therapy (MDT) following WHO recommendation. 1983, program renamed as National Leprosy Eradication Program. 2005, India achieved elimination of leprosy as a public health problem. The prevalence was less than 1 per 10,000 population at national level. Continued efforts are ongoing to sustain elimination and reduce new cases. What is leprosy? Leprosy is a chronic infectious disease caused by Mycobacterium leprae, characterized by hypopigmented or reddish skin patches with loss of sensation, thickened peripheral nerves, muscle weakness, and deformities in advanced cases. Leprosy, also known as Hansen disease. Let's see the cardinal signs of leprosy. The mnemonic SNA. Sensory loss in skin patch, nerve thickening, acid-fast bacilli present. Leprosy signs and symptoms. Mnemonic planned. Patches, that is hypopigmented or reddish patches over the skin. Loss of sensation. Anhidrosis, that is no sweating. Nerve thickening, numbness, eye problems, also deformities. The primary objective of this program to eliminate leprosy as a public health problem, reduce the prevalence to less than 1 case per 10,000 population. The specific objectives are early detection of cases, that is identify leprosy cases at an early stage to prevent complications. The prompt and complete treatment, provide free multi-drug therapy to all diagnosed patients. Also interrupt transmission, reduce spread of infection in the community, disability prevention and management by prevent deformities through early care and treatment, provide medical and surgical rehabilitation, reduce stigma and discrimination, promote awareness and social acceptance of patients. Strengthen surveillance system by improving reporting, monitoring and evaluation of cases, capacity building of health staffs by giving training to the healthcare workers for ANM, ASHA, nurses, doctors, community participation by encouraging the public involvement in detection and awareness about the leprosy control. Integration with general health services by delivering the leprosy services through primary healthcare system. Special focus on high-risk areas by target endemic districts, urban slums and the tribal population. Purpose of this program are to eliminate leprosy as a public health problem, to reduce the disease transmission, to provide early diagnosis and complete treatment, to prevent disabilities and deformities, to ensure rehabilitation and social integration of patients. Importance of this program: prevents long-term disabilities and deformities due to leprosy, reduces stigma and discrimination associated with leprosy, improves quality of life of affected individuals and their family, promotes early detection and treatment, contribute to overall public health improvement. Strategies to overcome this problem: early case detection through active and passive surveillance, multi-drug therapy for all the diagnosed cases, integration of services into general healthcare system, information, education and communication activities, disability prevention and medical rehabilitation, training of healthcare workers, monitoring and evaluation of program performance, community participation and the awareness about leprosy. Strategies in simple we can say is that EDIT CMM, that is early detection, drug therapy, IEC activities, training, community participation, monitoring and medical rehabilitation. Achievements through this program. We have elimination of leprosy at national level by 2005, free availability of MDT across all health facilities, significant reduction in prevalence and case load, improved awareness and reduced stigma among the community, strengthened surveillance and reporting systems, integration of leprosy services into the primary health care. Drug regimen by the multi-drug therapy. It's a standard treatment for leprosy. For passibacillary, duration of 6 months we are providing these medicines. Drug name rifampicin, monthly supervision we need to give, and dapsone daily they can take. And for multibacillary cases, duration 12 months, that is 1 year. The drugs are rifampicin, that is under the monthly supervision can be given. Clofazimine monthly and daily they can take. Dapsone daily they can take. That is MDT is provided free of cost in all government health facilities. Drug regimen in mnemonic RDC, that is rifampicin, dapsone, clofazimine. For BB versus MB durations, that is BB 6 months, P is petit, and the MB 12 months, M is massive. Services at primary health centers, early detection and diagnosis of cases, administration and monitoring of multi-drug treatment, management of lepra reactions, referral services for complications, health education and counseling, recording and reporting of cases, follow-up and disability prevention, distribution of protective aid like footwear. Services as primary health centers are prevention, early diagnosis and treatment, conduct screening, health education, improved hygiene and living conditions. And regarding our rehabilitative services are medical rehabilitations, they are doing the surgery or providing physiotherapy, vocational training, social and economical rehabilitations based on the condition. Indicators are prevalence rate, annual new case reduction rate, proportion of child cases, grade 2 disability rate due to leprosy. Challenges, hidden cases in community, social stigma and discrimination, delayed diagnosis, also urban migration and slum population. Role of nurse in eliminating leprosy, identify suspected leprosy cases during community visit, assist in diagnosis and classification of cases, administer MDT and ensure treatment adherence, educate about patients and families about the disease and prevention, provide wound care and disability prevention measures, maintain records and reports, conduct awareness program in the community, support rehabilitation and reduce stigma, monitor for drug side effects and complications. In mnemonic, we can say CARES. C for case reduction, A administration of MDT, or record keeping, E education, and S support and rehabilitation. Let's summarize this topic. The National Leprosy Eradication Program is the Government of India initiative aimed at eliminating leprosy, a chronic infectious disease caused by Mycobacterium leprae affecting the skin and nerves. Started in 1955 and strengthened with the introduction of multi-drug therapy in 1982, the program achieved elimination at the national level in 2005. The program focuses on early detection, free MDT treatment, disability prevention, awareness, and integration with primary healthcare services. Primary health centers and nurses play a vital role in implementation through the diagnosis, treatment, education, and follow-up. Despite major achievements, challenges like stigma and delayed diagnosis remain, and ongoing efforts aim for a leprosy-free India with zero disability and discrimination. Let me conclude that the National Leprosy Eradication Program has significantly reduced the burden of leprosy in India. Continued efforts in early detection, treatment, awareness, and rehabilitations are essential to achieve a leprosy-free society. Thank you for your patient listening.